All right. So another topic I feel like is very important and that can be talked about just uh, in sense is breaking bad news. So this is something that is an art, right? And actually, might it's not in the sense. I mean, there is a structure to it. Usually, what we follow is something called a Spikes criteria. So, what this criteria entails is settings. So, I mean, just what they stand for means settings, perception, invitation, knowledge, empathy, and summary. So these are basically the different aspects that you different steps that you're going through as you break the bad news, and it's very important that you do not rush through these steps because you're not, because for you it might just seem like a process, but it's important for you to understand the significance, to show some empathy, right? Knowledge enough, your knowledge alone is not enough. You have to understand. You don't have to sympathize, but you have to be show some empathy. So now, so let's get to the first one, which is the spikes. Spikes. The first one of the spikes is settings. So you have to, have the appropriate, uh, setting. It has to be a room with no disturbances, so that you don't get interrupted when you are giving this information, this sensitive information. So arrange a room, ensure it's silent, ensure a time where you are not interrupted, and then you can take the patient so that you can break the bad news, inform the details to the patient. Right. So this is for first. It is about setting the scenario, setting the right. Now come to the perception side. Now, so you have now brought the patient in to your place, where with less interruptions, and now you just start to communicate with the patient. You introduce yourself. By the time now you probably are pretty familiar and you have built up decent amount of rapport with the patient. So now you ask about, like, what do you know about your disease so far? Then the patient will say, they told me this, something like that. The investigations were something and so on. So they wanted to see, do something much further. So this is how you get a perception. Then you can invite the patient, right? So you are inviting the patient to. So I mean, you can also to. The results are not what we were expecting. The results are somewhat not up to what our satisfaction levels. So something like that. You can give some kind of a hint, right? And the patient can also be, they can decline the information if they want. Some people are just not willing for the entire information. So there, this kind of denial of the information can happen, right? So where you try to give, then you might have to wait until you to see how they deal with it. So then knowledge, then you start to talk about the issue, but you try to avoid a lot of the medical jargon and you try to keep it as simple as possible, because the aim is to break the bad news. It's not you who needs to present the information, it's the patient who needs to perceive the information in a much in a simple manner, right? That's the only way they can perceive it. So ensure that most of it is perceived by the patient. But as you give this information, ensure that there is empathy. Do not jump right through like some kind of robot. Right? When you're giving information, pause. Let them take that information in. Let them analyze it. It's not going to be easy. It's probably bad news. It's going to be really heartbreaking. There's a lot of difficulty. There's a lot of things they have to run through in their head. So there's no need to rush it. That's the most important. You would not be rushing it. So that is one. And then finally, you are summarizing the entire thing, because there's a lot of information involved and you need to ensure that the information that you talked about did get through and is what they are interpreting, so they are perceiving it correctly. You don't want to give false hope, you don't want to over exaggerate things, you want to show the real reality. And then you are giving the management plans and what could be done, what is the next step. So that is the purpose of this Breaking Bad news.